Welcome. Have you ever heard of something affecting your vision and balance at the same time? Today, we're diving into a condition that does just that: ototoxicity-induced vestibular dysfunction. This mouthful refers to balance problems and sometimes vision disturbances that stem from damage to the inner ear, specifically caused by certain medications or chemicals. Understanding this connection between our ears and eyes is crucial for early detection and effective management. So, what exactly causes this connection to break down? The culprit is ototoxicity, which means ear poisoning. Certain medications, particularly aminoglycoside antibiotics like gentamicin and streptomycin, chemotherapy drugs like cisplatin, loop diuretics like furosemide, and even some over-the-counter pain relievers in high doses can damage the sensitive hair cells within the inner ear. These hair cells are vital for both hearing and balance, and their destruction leads to the dysfunction we're discussing. Certain environmental chemicals can also contribute to ototoxicity. Let's understand what happens inside. These ototoxic drugs are absorbed into the inner ear fluids and, in susceptible individuals, they accumulate and damage the hair cells of the vestibular system. This damage disrupts the normal signaling pathway from the inner ear to the brain. The brain relies on this signaling for spatial orientation and balance. When the vestibular system is compromised, the brain receives inaccurate or incomplete information about the body's position and movement, leading to vestibular dysfunction. Furthermore, the connections between the vestibular system and the eyes, known as the vestibulo-ocular reflex or VOR, can also be disrupted. The VOR normally allows for stable vision during head movements. Damage to the VOR results in symptoms like oscillopsia, where vision appears to bounce or blur during head movements. While there aren't precise numbers on ototoxicity-induced vestibular dysfunction, we know that a significant percentage of patients receiving ototoxic medications will experience some degree of inner ear damage. The likelihood increases with higher doses, longer duration of treatment, pre-existing hearing loss, kidney problems, and genetic predisposition. Certain populations, like children and the elderly, are also more vulnerable due to factors like developing or aging auditory systems and increased sensitivity to medications. The symptoms of ototoxicity-induced vestibular dysfunction can vary in severity but often manifest as dizziness or vertigo, a spinning sensation even when still. Imbalance and difficulty walking, especially in the dark or on uneven surfaces, are common. Patients may experience oscillopsia, the bouncing vision. Nausea and vomiting can accompany the dizziness. Hearing loss and tinnitus, or ringing in the ears, are also frequently reported as the ototoxic drug damages hair cells responsible for both hearing and balance. Diagnosis starts with a thorough medical history, focusing on medication use and any history of inner ear problems. A physical examination, including neurological and otolaryngological assessments, is essential. Audiometry, a hearing test, is performed to identify any hearing loss. Vestibular testing, such as videonystigmography of VNG or rotary chair testing, helps to assess the function of the inner ear and the vestibulo-ocular reflex. These tests measure eye movements in response to various stimuli, providing insights into the extent and nature of the vestibular damage. While ototoxicity-induced vestibular dysfunction doesn't have specific types in the traditional sense, it can be classified based on the severity of symptoms: mild, moderate, severe, and the specific areas of the vestibular system affected. Some patients might primarily experience horizontal canal dysfunction, while others might have issues with the superior or posterior canals. Further, the presence of hearing loss alongside vestibular dysfunction is a common and important consideration. Treatment primarily focuses on managing the symptoms and preventing further damage. Vestibular rehabilitation therapy, VRT, is a cornerstone of management. VRT involves exercises designed to retrain the brain to compensate for the impaired vestibular function. Medications like antiemetics can help control nausea and vomiting during acute episodes. In some cases, if the offending medication can be safely discontinued or an alternative found, this is a critical step. Hearing aids may be needed if hearing loss is present. Lifestyle modifications, such as using assistive devices for walking, can improve safety and independence. Prevention is paramount. Whenever possible, ototoxic medications should be avoided, especially in individuals with pre-existing hearing loss or kidney problems. If ototoxic medications are necessary, the lowest effective dose should be used for the shortest possible duration. Close monitoring of hearing and vestibular function during treatment is essential. Patients should be educated about the potential risks and instructed to report any symptoms of dizziness, imbalance, or hearing changes immediately. Adequate hydration and avoiding concurrent use of other potentially ototoxic substances can also help minimize the risk. The prognosis for ototoxicity-induced vestibular dysfunction varies. Some individuals experience significant improvement with vestibular rehabilitation therapy, while others may have persistent symptoms. Early diagnosis and intervention are crucial for maximizing recovery. Recent research is exploring the use of antioxidant therapies to protect hair cells from ototoxic damage. Gene therapy and hair cell regeneration are also promising areas of ongoing investigation, offering hope for future treatments that can restore lost vestibular function.